Thank you, Tom, and good afternoon, everyone. I am pleased to report today that 6,961 Albertans have now recovered from COVID-19. We've conducted about 9,000 new tests in the last 24 hours and have identified 46 additional cases in the province. Currently, 39 people are hospitalized with COVID-19, with 6 of these in ICU. In the last 24 hours, I am happy to report that there were no COVID-19 related deaths. We are now a week into stage 2, and more than a month has passed since stage 1 began. By far the most common question that I am hearing these days is why the number of active cases has gone up and not down. This is a natural question. On Friday, June 5th, we had 339 active cases in the province. Today we have 512 active cases, with many of these occurring in the Edmonton and North zones. This means we have about 173 more active cases than there were 2 weeks ago. I want to talk today about what this increase in cases means and what factors seem to be contributing to the spread of the virus. First, it is important to note that so far, our hospitalization rates have remained steady and actually have gone down slightly over the past 2 weeks. And as I have mentioned before, we did expect to potentially see an increase in cases during stage 2 as more Albertans began interacting in their communities. We continue to monitor the level of cases and the hospitalization rate closely. It is a valuable measure of how the relaunch is going. The recent data also shows some positive trends. For example, most of the active cases in Alberta right now are from a known source. That's positive as it means we can stop the spread faster. There are also now only 26 active cases in continuing care facilities, with more than 708 recovered cases across the province. So far, we have not seen outbreaks or significant transmission related to any outdoor activities. These are all positive signs. However, there are other trends which remind us that we have to remain vigilant to prevent future outbreaks of COVID-19. We are continuing to identify active cases in all age groups, and Edmonton zone now has nearly as many active cases as Calgary. The locations of our new cases have largely shifted from continuing care environments to community settings, such as workplaces, and large gatherings, such as funerals. For example, 2 recent funerals have led to a combined total of 24 new cases in Alberta, with many more close contacts potentially exposed. The total number of cases will likely rise in the coming days. This shows how easily the infection can spread. Other key areas of risk are social gatherings like birthday parties and work meetings where distancing and masking are not in place. It's important to note that indoor gatherings have a higher risk than outdoor gatherings. The bottom line, though, is that anywhere people are gathered together, not distanced or wearing face masks, COVID-19 can easily pass from one person to the next. In some of the examples we have seen lately, the person who was the source of infection did not have symptoms at the time. They only developed illness later, yet they were infectious before their symptoms started, which enabled the virus to spread. As many Albertans make plans to return to working in person rather than remotely, workplaces need to consider how they will ensure that distancing and masking, when needed, are firmly embedded in their return to the workplace strategies. We also have at least one example of transmission in an apartment building where we have identified 12 cases in a single building. At the moment, it seems that transmission is most likely to have happened through common high-touch surfaces, emphasizing the need for cleaning and disinfection of these surfaces. Today, we are also listing a new outbreak at the Materials Recovery Facility in the Edmonton Waste Management Centre. AHS is keeping a very close watch on every active outbreak, providing whatever testing and other support is needed. So what does this all mean? It means that the virus is still here and it is not going anywhere. It also means that even if we are feeling healthy and symptom-free, we all need to continue operating as though we could spread the virus to others and could catch it from those around us. This is not the time for complacency. We are not out of the woods yet and will not be for quite some time. We must all be vigilant in following the public health measures, particularly when indoors or attending any group event. By now, I believe most Albertans could recite my health advice in their sleep. Stay 2 meters apart, wear masks when you can't, get tested and stay home if you're feeling ill. The biggest lesson from the last 2 weeks is that we remain each other's best defense against the virus. Every Albertan has a role to play in keeping their friends, family, and neighbors safe. This weekend, I challenge each Albertan to be the voice of leadership among your friends and family. It is a good thing to remind others of the health guidance in place and to promote good hygiene practices at a birthday party or family outing, or wearing masks while out in public. Diligently following the public health measures in place means that you are being considerate and caring, not overcautious or afraid. Let's all see it as our personal responsibility to follow the measures and keep others safe. The health system will continue doing its part. Our labs continue to test more people than ever, and our health officials are working extremely hard to identify new cases and implement all appropriate measures to contain spread. We are all in this together. Thank you, and I'm happy to answer any questions.
All right, we'll go to the phone. Operator, could you put through the first caller?
Yes, thank you. The first question is from James Keller of the Globe and Mail. Please go ahead.
Hi there. There have been some calls to make masks mandatory in public in certain settings in Alberta and elsewhere. What are your thoughts on that idea, making masks mandatory at the provincial level? And what would you think of local governments taking their own steps to implement some sort of requirement to wear masks, for example, on public transit?
We are looking at the emerging evidence around mask wearing. There certainly seems to be evidence from other jurisdictions that wearing masks when in public, especially when in more crowded places, is effective in preventing the spread of the virus. And that's why we are making masks broadly available to all Albertans and encouraging all Albertans to wear masks whenever they're in those places. At the moment, we are focusing on that encouragement and strong recommendation, and it is not mandatory at this time from a legal perspective. However, again, we are encouraging all Albertans to do their part in preventing spread. And if a local municipality were to choose to create some of those requirements, for example, on transit, that would absolutely be within their purview if they wish to do so.
Operator, can you put through the next question, please?
Yes, the next question is from Julia Wong, Global News.
Hi, Dr. Hinshaw. Two quick things. Is there an update on easing visitor restrictions on continuing care facilities? And how is the input from operators, families, and residents shaping what that policy will look like? Also, what can we expect in terms of timing for phase 3? What needs to happen before then, and what is it dependent on? For example, does there need to be a vaccine or viable treatment for COVID-19 first?
Thank you for that. I know that the visitor restrictions in continuing care centres is a very hot topic of conversation, and we really want to hear the voices of residents and their families as well as operators. So we have put together some opportunities next week for individuals who are either living in those settings, who are family and friends of those living in those settings, or operators of those settings, to be able to give us their feedback on what solutions they can see to be able to balance the needs of human interaction, social connection that we all have against the needs for protection from infection spread, which is particularly dangerous in settings where there are many people living together who have either chronic health conditions or are of older age or both. And so that, again, next week is going to give us the opportunity to hear from people, hear their perspectives and their suggested solutions so that we can incorporate their perspectives into an updated visitor guideline. With respect to stage 3, we're looking at the metrics that we've laid out in terms of hospitalizations, ICU, as well as looking at our reproductive rate and our cases as those more contextual measures. We will be watching closely. We've only completed 1 week in stage 2, and so it is a little bit early to determine how stage 2 is going. So we'll need to be watching for some time to determine whether or not we're in a place where we can further ease restrictions. And what I would say to Albertans about the timing of stage 3 is that the better we are all collectively able to have these increased opportunities to be out and about and at the same time hold on to those basic public health measures, the quicker we'll be able to see stage 3 come. Unfortunately, if we do see a spike in transmission, as some of the US states have seen when they've started to open, that will delay our ability to move forward.
Operator, can you put through the next caller, please?
Yes, Kevin Nimick, CTV Calgary.
Hi, Dr. Hinshaw. It's been about 2.5 weeks since the first rally against racism in Calgary and around the same time in other municipalities in Alberta. Thus far, how many cases have we seen linked to these types of gatherings? And are you still concerned about large group gatherings like rallies going forward?
So far, we have not seen any cases that we have linked to a protest as the cause or the source of that infection. What we do know is that many of those who gathered were wearing masks, which potentially mitigated that risk. And what I would also say is that as our active case numbers creep up across the province, that any kind of gathering, certainly outdoor gatherings are less risky than indoor, but any kind of gathering, the more active cases we have in the community, the higher risk gatherings become, because there's a higher likelihood that you could have one person who's infectious at that gathering. So I remain concerned about any large gatherings where distancing is not followed, where masking is not used, and we have produced guidance for demonstrations, rallies, and marches that can help with the prevention of COVID, while at the same time supporting, giving voice to causes where people are wanting to rally together and bring forward opinions in a public way. So we are trying to support both of those things at the same time.
Operator, can you put through the next one, please?
Harry Reith, CBC.
Yes, hi, Dr. Hinshaw. Today we saw several cases of pro athletes testing positive for COVID-19 in Florida, and that included some members of the Tampa Bay Lightning. Does this give you pause in allowing the NHL to use Edmonton as a hub city?
The construct that we put together to allow Edmonton to be used as a hub city, if that is the direction that's chosen, includes 2 types of quarantine or of cohorting. And so the first is to allow, when teams come in from outside the country, to allow them to be in a kind of cohort quarantine where they're in small groups for that first 14 days, and they are tested regularly as well as having regular symptom checks. The quarantine that they're required to be in does not put them in contact with the general public during this time. And so it does mitigate the risks to the public of any of that potential transmission in the first 14 days. The second phase continues to require a cohorting effect. Once that 14 days is over and there's no cases confirmed to have happened in that group, the second phase of play would involve making sure that all of the teams were kept in a sort of quarantine bubble separate from the public to prevent the introduction of the virus into that cohort, which is now moved through that 14-day quarantine and confirmed to be free of virus. So I don't know the circumstances in terms of the Tampa Bay, Florida, the Tampa Bay players testing positive. What I do know is that we've had multiple conversations with the Edmonton Oilers and the Calgary Flames to ensure that they understand what our guidance looks like, how it will protect both the players, the staff, and the public. And I believe that the protocols that we have in place would effectively prevent transmission.
Operator, can you put through the next one, please?
Yes, Chris Epp, CTV Calgary.
Thank you. Dr. Hinshaw, when the contact tracing app was launched here, I believe you said you hope for at least 20% of Albertans to download it for it to be effective. I think right now we're sitting at around 5%. Are you disappointed that more people haven't downloaded it? And I'm also wondering how you expect it to interface with this national tracing app coming up. And maybe you could also just say how many people have actually been contacted with possible exposure as a result of that app. Thank you.
I would say that I hoped that we would have a higher proportion of Albertans downloading it. I also know that for those Albertans who use Apple products, the way that this particular app works can be inconvenient with the requirement for the app to function in the foreground with the phone turned on. And so I can understand why people who are using those products would perhaps not wish to download. Having said that, I would, as always, encourage all Albertans to download it. It will be more effective the more people have it on their phones. We are in discussions with the federal government with the new announcement of the federal app that they're putting in place. And our goal is to be able to have an interoperability between the different apps. That's something that we're pursuing and again, in conversations. And with respect to having people contacted from the app, I haven't gotten an update recently from AHS, so that's something we can look into and get back to you.
Operator, can you put through the next question, please?
Yes, Dustin Cook, Edmonton Journal.
Hi, Dr. Hinshaw. I have a question about the materials recovery facility outbreak in Edmonton. Do you have any details about how the virus spread at that facility where there was significant contact with recyclables?
I don't have details about the spread at this time. I know that Alberta Health Services is working closely with the organization, with the managers of the particular unit that's affected, but unfortunately I don't have information about the specific details and what the risk was seen to be at that location.
Operator, can you put through the next one, please?
Dylan Short, Post Media.
Hi, Dr. Hinshaw. Recently, there's been some studies out of England that says the 2-meter distance restriction rule is based on not so great evidence. As well, the Alberta Hospitality Association has called to shrink the 2-meter rule, especially in restaurants and other food settings. So I was wondering, how did you decide on the 2 meters, and would you consider reducing that distance to maybe 1.5 meters or 1 meter in restaurants and other places?
When we originally set the 2-meter rule, we were working together with our partners across the country and looking at other analogous organizations such as the Center for Communicable Diseases in the US, which has the 6 feet rule, which is roughly analogous to the 2 meters in Canada. And what we did is looked at the evidence from droplet spread, what we know of in illnesses that are spread by that droplet route, and what kind of distance is protective. The evidence coming out of England and other evidence that's being produced would be of interest. It is of interest. We're looking at it. And at the same time, I think what is important to remember is that there is no one distance that will be 100% protective at all times and in all circumstances. And so it's important when we consider the distance that it's not just the that particular metric, but we consider all the different circumstances that people might be in. And so the 2 meters is, of course, more protective than 1.5 or 1 meters. We also know that other countries do have either a 1 meter or 1.5 meter recommendation. But at this point, we are, again, having conversations across the country with respect to national alignment. It would be very confusing to have different recommendations or different requirements in different provinces. And we know that the further apart you are from someone, the least likely you are to be infected if they have the virus, and that as you get closer and closer together, the risks would increase. So trying to find what that cutoff is to be reasonable, but at the same time protective. Again, there's no one perfect solution.
Operator, can you put through the next question, please?
Darren Vecchio, Harvard Broadcasting.
Hi, Dr. Hinshaw. I appreciate you taking my question. I know you kind of touched on it earlier in your speech when it comes to the increase in cases, but I was hoping you might have some information specifically on the recent spike we've been seeing in Fort McMurray and more specifically the region of Wood Buffalo. We've seen about 20 cases over the last week after having 0 cases in about a month, specifically in those rural areas. Is there a specific reason for this spike, maybe a mix of new testing, possible links between cases?
So the particular group in the north is one of many groups that are linked to a social gathering. So again, I mentioned earlier that we've seen that as a common thread in clusters of cases in multiple places in the province. So that particular group is a bit more visible because there haven't been cases there, but it is a reminder that when people gather together for social gatherings, there's always a risk that if even one person is infected and doesn't know it, and perhaps in their pre-symptomatic phase, that many people can be infected from a single interaction. And so there's a common social gathering that seems to be a link for the majority of those cases, and Alberta Health Services is working closely with cases and making sure that they understand what's needed to prevent further spread. And I am confident that that good collaborative work with all of those who are impacted by that particular event is going to result in good outcomes. Again, there's been very good work together collaboratively with all those who are impacted.
Operator, can you put through the next question, please?
Brendan Palou, My PG Now.
Yes, hello, Deena. Thank you very much for taking my question today. Hope your day's going well. My question to you, talk about the reopening to casinos in phase number 2 in Alberta. You have twice as many test positive cases than we do here in BC, and casinos are last on our list to reopen. So I guess my question is there more confidence that there will be little to no spread even though you have more cases overall in your province?
When we looked at different options for opening different types of establishments, different services, different activities, one of the things we looked at was how analogous they might be to activities that were already open, where we hadn't seen much trouble. So we have had, for example, shopping malls and retail open since the beginning of stage 1. And when we looked at casinos as an option, we looked at the different protocols that had been put forward by that particular group of operators with respect to how the cleaning and disinfection, distancing, and or barriers could be put in place. And we looked at the types of activities in casinos. So, for example, in this stage, we are not allowing table games to proceed, given the fact that there's more interaction, there's potentially more chance of transmission. So it is mostly those seated events or activities that are taking place in casinos, with the expectations that operators will follow all of the distancing, the barriers, the sanitization, and masking if distancing is not possible. That's really the expectation of any operator who's open at this time. So given that we felt that those particular activities could be more analogous to, for example, restaurants or shopping malls, that it seemed that casinos could open, again, with those mitigation measures in place, as we haven't to date seen significant issues with those other locations, as long as all of these public health measures are followed.
All right, we've got time for 3 more questions. Operator, could you put through the next one, please?
Yes, Laurent Pirot, Radio-Canada.
Hello. I was wondering whether we have any evidence of contamination happening in bars, restaurants, or some similar settings.
We haven't yet seen outbreaks or clusters of cases linked to those settings in our current opening. We did see, before we had closures happen a few months ago, we did see a couple of cases where there were groups of dining parties that were together where all of them ended up being infected after a common meal, or where a server passed infection to others. So we know that it is possible. So the fact that we haven't seen it yet is, I would say, a good thing, and yet it's also a reminder of the fact that we need to be vigilant, we need to continue to be vigilant and keep that good track record, rather than thinking that we can ease our measures within those locations.
Operator, can you put through the next question, please?
Jason Herring, Calgary Herald.
Thanks for taking my question, Dr. Hinshaw. I want to go back to the topic of masks. Today, a number of Calgary doctors with the Masks for Canada advocacy group called on provincial and federal health officials to mandate face coverings in all indoor public spaces, crowds, and transit spaces. Their major worry is that Alberta is going to implement explicit rules around masking too late to reduce COVID spread. So my question is, will Alberta follow that call to make mask use mandatory in some situations, and if not, why?
It's really important for Albertans to know how important masks are as a part of our overall strategy. That's been something that we did wait for the evidence to accumulate before we made recommendations, and it's becoming increasingly clear that when people are in crowded spaces, when they're in places where there's many people who perhaps don't know each other, that masking is a very important measure to prevent the spread of transmission. I think the challenge of deciding whether or not to make something mandatory is determining, again, how effective our strong recommendations are. We did relatively recently move towards this recommendation. I think it's too early to determine the impact of the recommendation. We're, again, working to make sure masks are available across the province through multiple methods of distribution. We are recommending that Albertans, when they're going to be in crowded public places or places where there's many people together, that they do wear this. And we want to give Albertans the opportunity to show that they are taking this seriously, that they're being responsible for their actions, and that we are collectively able to prevent the spread. I think it's important for Albertans to remember that our ability to collectively prevent the spread of COVID-19 and keep our case count low is our best insurance against having to do any kind of mandatory measures in the future, whatever those mandatory measures might be, because we know that if we have low transmission rates, we can continue to keep things open and potentially consider further expansion. So again, right now, there's been a clear policy decision to not have masks mandatory at this time. However, we do strongly recommend that Albertans do wear masks, and we're making them available and ensuring that every effort is made to make it as easy as possible for Albertans to wear masks when they are in public places.
All right, we'll go to the final question. Operator, can you put them through, please?
Thank you. Yes. Daniela Germano, CP.
Hi, Dr. Hinshaw. This is another question relating to the NHL. I just wanted to get information just a little bit more specific. So if a player does test positive for COVID-19, what would the next step be? Obviously, granted that Edmonton becomes a hub city. Would they be quarantined, or would the whole team be?
What would happen if a player tested positive is, of course, the first thing would be that public health would be in contact with that individual to find out when their symptoms started, who they were in close contact with during the time that they were potentially infectious, and then make sure that those close contacts were notified. So it would really depend on the context. If, for example, a player tested positive and they were not in contact with anyone during the time period when they were infectious, just given the cycle of rest days, practicing, game days, then there would be much less impact from that particular person testing positive than if someone was considered to be infectious while they'd be in contact with many others. So depending on the circumstances, it would have differential impact, and we would have to be in close contact with the NHL, with the players, to determine whether or not a cohort quarantine, similar to what we're doing for the 14-day quarantine coming in terms of small numbers still being able to be together while they're in that quarantine period, if that would be acceptable, or if we would be doing the individual quarantine. And again, those would be conversations that we would be having at the time based on the circumstances, based on the risk, and who potentially could have been exposed. But whatever we do, whatever the circumstances end up determining, we would ensure that there would be no risk to the public and no risk for spread outside of that particular cohort.
All right, thank you for joining us, everyone. Dr. Hinshaw will provide another update on Tuesday afternoon. Thank you.